What should you do after your dog is diagnosed with a tiny mammary tumor the size of a bean? When a mammary tumor develops in a small breed dog, because of this small tumor, there is some hesitation about surgery. At times like this, most owners wonder if they should just monitor it. Because the tumor is small and the risk of anesthesia is significant, they cannot easily decide on surgery. In this case, they just do nothing and observe. In such cases, a large mammary tumor usually develops, or there may be multiple metastases, or it progresses into such a large tumor, or treatment is performed after a very large tumor has developed, or there are cases where surgery is decided upon. What is the best way to wait before deciding on surgery or treatment? We can look at two cases for now. There are cases where neutering surgery has not been done. Some dogs have been neutered. If the dog has not been neutered, dogs go into heat every 6 months. When this happens, the female hormones in the ovaries stimulate the development of the mammary glands. At that time, the mammary tumor also develops simultaneously. So, for most owners, the mammary tumor, which was as small as a bean, suddenly grew rapidly one day. Then, in most cases, it is the estrus period when many female hormones are produced. So, what should be done then? At each visit every 6 months, the female hormones produced by the ovaries need to be blocked. If that happens, a prescription for hormone blockers is given. The rapid growth of mammary tumors causing problems cannot be completely prevented. Still, it is possible to prevent situations where it grows to an enormous size. Secondly, the yellow areas you see here represent cancer stem cells. The blue areas like these indicate cancer cells. Typically, chemotherapy removes the cancer cells. However, these cancer stem cells are not removed. So far, no drugs have been developed that can eliminate cancer stem cells. After some time passes, these cancer stem cells again produce cancer cells again like this, leading to recurrence. Or the metastatic cancer stem cells form new cancers in other places, such as the lungs, liver, or spleen. In such cases, there are drugs that can somewhat hinder the process of cancer stem cells producing cancer cells. Simply put, there are drugs that can inhibit the cell division of tumor stem cells that produce these cancer cells. Taking this drug cannot kill the cancer stem cells, but it has the effect of delaying, to some extent, the rapid growth of these cancer cells. Therefore, when using drugs that inhibit the cell division of tumor stem cells, it is possible to somewhat block the rapid growth of the developed tumor. The second case is when neutering has been done. In the case of neutering, the rapid growth of mammary tumors caused by female hormones cannot occur, because there are no eggs. Therefore, it suppresses the process by which tumor stem cells produce cancer cells. You just need to take a cell division inhibitor targeting tumor stem cells. So what we want is, when a small mammary tumor first appears like this, after that, even after 3 months, 6 months, and 9 months, our goal is that there is no significant change in the size of this tumor, and also the tumor stem cells that may have metastasized somewhere. The goal is to prevent them from growing any further beyond a similar size. If you have discovered a mammary tumor and do not intend to just observe it, you can contact Leo Animal Hospital. Thank you. Leo Animal Hospital. Leo Animal Hospital. Leo Animal. Leo Animal Hospital. Leo Animal.